My name is Crystal Linderberry, and this is my Army story. My name is Crystal Linderberry. I'm a major in the Army. So I commissioned in 2011 when I finished vet school. I joined the Army before that as part of the Health Professions Scholarship Program, and I decided to do that because I already wanted to be a veterinarian. Yes, they offer a scholarship, but for me, I have a lot of military family. So for me, that was a big reason I decided to join up, sort of that tradition. So the Health Professions Scholarship Program is a military program, and one of the ways the Army fills the slots it needs for doctors, dentists, optometrists, veterinarians. And it offers a scholarship between 1 and 4 years for those professionals to go through their training programs. So HPSP, when you are in the program, they pay tuition, they pay some expenses, but one of the major benefits is in those programs, most of us are working so hard. We can't work a job. We can't try to do that part-time stuff to really make a paycheck. And so the scholarship also offers a living stipend, and so that gives you the time to really focus on your studies, knowing that you'll be able to get to the grocery store when you need to. So I went to undergrad in Walla Walla, Washington, and I have a BA in Asian Studies, which does not seem like a normal path for a veterinarian, but I got to do that, and it's actually been incredibly useful having that liberal arts education, that broader education. And then I went and specialized in veterinary medicine and got my doctorate of veterinary medicine at Washington State University. So I'm the 64 Foxtrot, which is an AOC or an occupational code for a clinical veterinary specialist. And that's the code the Army uses for all veterinary specialists, from surgeons, internists, emergency people, behavior. We all are the same code. I am specifically an internal medicine specialist. So Army veterinary medicine has 4 main missions. So that's animal care, animal medicine, veterinary public health, food protection, and then we also participate in a lot of research and development programs. Well, I wanted to be a vet from the time I was little, so it's hard to say why that is, but I have a family tradition of military service, so I already knew I wanted to be a vet, and we got the family tradition, so it was a good way to put them both together for me. So the best part of my job for me is working with soldiers and then working with our patients. So our patients, the military working dogs, also other animals we interact with, and because we're trying to heal or improve the medical condition of our patients, but the Army mission is never just about that specific job. It's about the team, it's about our soldiers, and it's about our mission at large. So getting to interact and do both of those and work with my soldiers is one of the best parts of the job. So I'm an internal medicine specialist. Back in the day, I used to be able to just tell people if they saw House MD, that's kind of what my training is. And nowadays, I tell people it's more about the squishy bits inside and helping with medical conditions that affect, the brain, the guts, the heart, the liver, all of those things. The Army's impacted my approach to veterinary medicine because it has definitely made me more flexible and more, I guess, wide-ranging in how I think about things. It's kept me from getting narrowed in and hyper-fixated on one thing, because we always are encountering new situations, and so you got to be able to adapt to those. So I've been in for 12 years. I've encountered lots of challenges over that time. I would say one of the biggest challenges, but it's also in some ways a bonus for us, is that we use a lot of things from the human medical side. So we don't usually use mostly veterinary specific stuff like you would on the civilian side. And so we get the opportunity, but also sometimes the challenge of using things that were meant for soldiers on the working dogs too. And it's a challenge sometimes because we're not used to those specific things, but also that means if I need a dog that needs some really fancy, expensive thing that you might not be able to get at a civilian vet clinic, if it's a working dog, that's not a problem. We can just go get it. But working with the soldiers, and I am, as a senior Army veterinarian, I get to work in a lot of training situations. So I work with our veterinary technicians, I work with younger new graduate veterinarians, and I loved the training, I loved the teaching, and for me that is one of the most rewarding things to do over and over again. And then we get to work as a team on the working dogs when they come in with whatever problem they come in on with. So this is my second go around in a deployable veterinary unit, and we do these exercises in every deployable veterinary unit, and they're absolutely critical because they allow us to actually be able to use our Army equipment. So if we have to pick up and go, we know how to pack it, how to ship it, and how to be able to set up to be functional when we get where we're going. But it also gives us a chance to kind of build that team building, build that camaraderie, and work on some very specific skills, especially skills relating to trauma care that we don't get to work on necessarily in a normal wellness practice. So the veterinary services in the Army has a set of courses that we get to do where you get to go and do advanced training on surgical stuff, on Army care stuff. We get the benefit of being involved with Army research and development. So all the new stuff they're coming out where they've got these new initiatives to help improve soldiers' ability to survive after injury. We get to see that, we get to use that with the working dogs, where out on the civilian side, you might not learn about some of those things for years after they're published. So the Army kind of has a built-in patient referral process. So every working dog gets all their normal routine vet visits. And if we identify something wrong, then they come back, they get a recheck, those issues get looked into. If the veterinarian who sees that dog first is like, hey, maybe this is out of my depth, I'm not sure, then they call me. And I go through it as a more experienced veterinarian and a specialist. And then if I can't help us get that dog to where it needs to be or come up with a medical plan to help that dog, then I have friends I call. So every dog has an entire tier of care that we go up and up until we can do what we need to do. In the veterinary field, there are some fancy gizmos, but most of our things that we do to make sure everyone stays healthy, whether it's human or animal side, is a lot about thinking, and it's a lot about teaching the humans to take care of the working dogs or to take care of themselves in order to stay healthy. And so it's less about fancy equipment and more about using the basics well. I was fortunate to deploy with the 72nd a couple of times earlier in my career, and I'm in a deployable unit now. And getting to go to places, whether it's in the Middle East or to Poland or on a mission to support the UN General Assembly in New York, getting to go to these places and take care of the dogs who are working and bring your resources and apply them is just, it really puts you in a position where you gotta use your brain, you gotta think, and you have the tools, but you gotta think and figure out how to adapt those tools to the situation you have in front of you. So the dog I'm thinking of, I'm gonna call him Jack. This is a working dog. He'd had diarrhea for like 2 or 3 months, and he was supposed to deploy. And his handler brought him in for an exam before they prepared to go and said, hey doc, he's been having diarrhea. And the doctor very astutely said, you know what, that's really not normal. Like maybe a dog get diarrhea once or twice, but this has been going on a while. We need to get this fixed before he goes anywhere. And so that veterinarian went ahead, did a physical exam, did blood work, did some basic imaging, and said, there's something wrong with this dog. All this stuff looks normal, but there's something wrong with this dog. And so they called me, and I went through the case with them. We talked about it, and I agreed, hey, there's something wrong with this dog. We need to do more. And so they brought the dog in, we did an abdominal ultrasound, and in the dog's belly, we saw something that wasn't normal. And so based on the ultrasound findings, I had some ideas of what it might be. Eventually, we took him to surgery to actually get our hands on the actual issue, and it turned out to be worse than we thought it was gonna be. And it was a surgery that was not a surgery that a general care practitioner should be doing. So we were able to actually transfer him from one state all the way across state lines to get him to a surgeon proper so the surgeon could fix him. And the surgeon was able to basically undo the problem he'd been having. And so he healed up, no long-term damage, and he's actually still working right now. I like being in the Army, so I share a lot. But one of the best things as a veterinarian, there is no other way I can be a veterinarian and go ride in a Black Hawk. It's just impossible. And so I get to be a veterinarian, and then I get to ride in a Black Hawk, and we get to practice doing things like critical care stuff while we're flying around. You don't get to do that all the time, unfortunately, but that is definitely a highlight and something that makes it easy to come to work each day. So one of the challenges that Army Vet Services have is that most of the practice we get is patients who are mostly healthy. Maybe they're having diarrhea, they have an ear infection, and the practice we need to be getting is dogs that are really sick. Because a dog that has an ear infection, he's probably going to be okay today, he's going to be okay tomorrow. We want to get him better, but it's not life-threatening. And so my hope for Army Vet Services is that we're able to transition to spending more time focusing on our skills to help those dogs who are hit by car or in an explosion, the dogs that really can't wait for care. Because right now, we're really, really good at the normal wellness stuff, and we need to, we're good at the trauma stuff, but we want to get better at it. Army veterinarians exist. I think that's the biggest thing. People don't realize there are veterinarians in the Army. And the other thing that I would like to communicate is that Army veterinarians, being in the Army, it's more about taking care of our team and getting our mission done. And that's always, getting our veterinary mission done is how we do that. And so veterinarians exist, and a lot of our stuff has to do with dogs, not all of it. My name is Crystal Linderberry, and this is my Army story.